Do you often feel restless, like you can't sit still even when you need to? Or maybe you start projects, but rarely finish them. What about losing your keys, phone, or wallet almost every day? If this sounds familiar, you might be experiencing something more than just being distracted. It could relate to Attention-Deficit Hyperactivity Disorder, or ADHD. Think of your brain like a car. In ADHD, the engine might be very powerful, but the brakes and steering don't always work smoothly. That's why people with ADHD may act quickly without thinking, get bored easily, or struggle to focus on one thing. It's not because they don't care, their brain just works a little differently. And guess what? Many smart, creative people have ADHD, like famous actors, scientists, and athletes. So why does the brain work this way in ADHD? Let's play detective. The main suspect: your genes. If your mom, dad, or sibling has trouble focusing, or is very hyperactive, there's a good chance ADHD runs in your family, just like blue eyes or curly hair. Another clue: brain chemicals. In ADHD, the brain doesn't use dopamine and norepinephrine as well as it should. These are like the messengers that help your brain say stay focused or wait your turn. If the message gets lost, you might blurt out an answer in class or forget your homework. Even things during pregnancy, like smoking, drinking, or being very stressed, can add to the risk. But here's the good news: ADHD is not caused by eating too much sugar or watching too much TV. That's an old myth. Now, let's talk about how ADHD shows up. Have you ever been told, "You're so smart, if only you just pay attention"? Or do you feel like your mind is a browser with 100 tabs open, all playing videos? In ADHD, common signs fall into 3 groups: inattention, hyperactivity, and impulsivity. Inattention means missing details, forgetting chores, or zoning out in conversations. Hyperactivity looks like fidgeting, tapping your feet, or feeling like you're powered by a motor. Impulsivity is acting without thinking, like interrupting others or spending money without planning. Imagine playing a video game where you see every enemy all at once, but you can't pick which one to fight first. That's what focus feels like for some people with ADHD. How do doctors know if someone has ADHD? They don't use a blood test or brain scan. Instead, they talk a lot. They ask you, your parents, your teachers, did you have trouble focusing since you were 7? Is it happening at school, home, and with friends? To get diagnosed, symptoms must be serious enough to cause real problems, not just sometimes I forget stuff. Now, treatment isn't about a one-size-fits-all pill. It's more like a toolbox. Medications, like stimulants, help the brain's messaging system work better, kind of like Wi-Fi boosting your signal. But therapy also helps, especially learning skills to stay organized. Think of it like learning to use a calendar app or setting phone alarms for tasks. Some kids go to ADHD coaching where they practice how to break big jobs into small steps. The goal, not to fix the person, but to help them shine in their own way. Can we prevent ADHD? Well, we can't change genes, that's part of who you are. But we can reduce risks early on. For example, pregnant mothers can protect brain development by eating healthy foods, avoiding alcohol and smoking, and managing stress. After birth, babies need love, routine, and safe environments. Things like regular sleep, healthy meals, and talking to them every day. For kids who show early signs, like trouble listening or constant movement, early support, like talking to a counselor or teacher, can make a big difference. Think of it like watering a plant early so it grows strong. You can't stop the seed from being what it is, but you can help it grow beautifully. Scientists are always learning more about ADHD. One exciting area: brain training apps. Some studies show games that practice focus and self-control can help kids improve attention, like mental push-ups. Another cool advance: researchers are using brain scans to see how different brains work during focus tasks. This might help create better treatments in the future. Also, more people now understand that ADHD doesn't go away when you grow up. Adults have it too. Many adults are getting diagnosed late, and that's okay. New tools, like smartwatches that remind you to take meds or move around, are helping people manage daily life. The future looks hopeful. Understanding, kindness, and science are teaming up to help people with ADHD